Hey everybody, welcome back to Tea Time with me, Dr. Smith from Accomplished Health and Wellness, and Heather, Heather Fiore from Free State Nutrition. And today we have some tea. And you know what happens? I was glad you were running a little bit late today because I actually put the water in, and then I went to get the tea, and I never went back. I went back like an hour and a half later, and it was a cup of water, and I was like, there's that tea. So anyways, this one is peach and pomegranate.
Wow.
Yeah, so who knows what it'll be. I think that peach has it seems to be the
dominant.
Yeah, the dominant flavor every time.
I would agree.
Yeah. Peach.
Mostly peach.
It does taste good though. So she's like, I'm a tea drinker.
I'm just along for the ride. It's good.
One of these days I'll just smell the coffee and I'll make you some. You just never know. A tricker. Okay, so today we're talking about hypothyroidism, right?
Yes.
Yeah.
Yes. And I figured you would be the person to talk about
the medical side.
Yeah, well, first, what does the thyroid even do?
Oh gosh, yeah.
Right? What does it do? What are the different kinds of thyroid disease?
There's so many.
I mean, one of the most common ones then maybe.
Yeah. So
yeah.
So what I was gonna do is talk about high and low.
Yes.
So your thyroid actually sits right here. And it's like this little kind of butterfly shaped organ that sits right here.
Mm-hmm.
Gland. And so it can get really big and it can actually swell, and we call that a goiter. Mm-hmm. And sometimes your doctor will try and examine it. Well, a lot of times at your physical they will. So that's what they're doing when they feel and then tell you to swallow. Because what will happen is the thyroid will kind of come up a little bit, and then maybe we can feel it. We don't want to feel it. Okay. That's our goal, is not to feel it. But if we feel something kind of come up and hit our hands, then that is an indication that maybe your thyroid is getting a little bit bigger, and so we should watch that a little bit closer. And so blood work that we do, we usually start with just a TSH is what it's called. It's a TSH stands for thyroid stimulating hormone. And that just kind of gives us an indication how well your thyroid is functioning. So the TSH, the thyroid stimulating hormone, comes down and then stimulates your thyroid to pump out thyroid hormone. Mm-hmm. I feel like we're really low.
Yeah.
So I'm gonna
yeah.
Oh, man. Okay. That's so much better. Man, I was feeling short. I am short, so. So anyways, you can get a goiter actually, or that enlargement in your thyroid. And it kind of looks like your neck is getting really fat. That's what it looks like. And you can get that actually with hyper or hypo. So we call it hyperthyroid, meaning your thyroid is hyperfunctioning or overfunctioning, or hypothyroidism, meaning that your thyroid is underfunctioning. And there's lots of reasons to have both. Most people out there have underfunctioning thyroid, but a lot of people do have overfunctioning thyroid. And so the thyroid actually dabbles in every system in your body. Pretty much. It's amazing. Mm-hmm. And so just some things we can start at the head. It dabbles in your brain. If you're underfunctioning or overfunctioning, it can affect your memory. And you can get this brain fog. It's kind of literally like you're walking in a fog. You can't remember anything. You can't really think clearly either.
Is it like being the parent of a newborn?
Yes. That first year when you don't, they're so lovely, those little babies, and we can't remember that first year at all. Right. Because there's no sleep. Yeah, exactly. Brain fog. Hair, and we're not even talking about just your hair here, but your eyebrows, your hair on your arms, under your armpits, on your legs, any pubic hair, anywhere that you grow hair. If you're hypo-functioning, meaning that your thyroid isn't functioning well, what will happen is your hair starts to fall out. So you start to get bald, it gets thin. If you're hyperfunctioning, what will happen is your hair starts to get brittle.
Mm-hmm.
So it'll actually get thin too, but it's actually because it's getting brittle and breaking, and the hair itself, the hairs will actually get thinner. So your hair's getting thinner and more brittle. But with hypo, it just falls out. Yeah. So you get bald. Your nerves, you can get peripheral neuropathy. And that's because the thyroid, actually, the underfunctioning will interfere with the signal being sent. And so you can get some like numbness and tingling and stuff like that. With hyperthyroidism, you actually will get a tremor because it actually makes your system go in hyperdrive. And so you're just like tremor.
Yeah.
So two different, they kind of function differently. So hyper puts you in hyperdrive and hypo puts you in low drive. So your signal isn't going as quick. That's why you're kind of like, I talked about the goiter. Heart attacks. Yeah, it can lead to heart attacks because it actually increases your cholesterol levels and it increases the bad levels, and it actually will interfere with your vascular system and in your blood vessels.
Oh dear.
Oh, this is an interesting new thing here. We have an interesting sound.
Sorry. Okay.
So it can narrow your arteries. It can increase. Oh, I thought they said hello. It can increase your blood pressure. And then the other thing is you can get palpitations or like feeling like your heart is skipping.
Yes.
And the skipping you can get with both under and over, hyper and hypothyroidism. But with hyperthyroidism, you actually will also get a racing heart, and you can also get an irregular heartbeat. So we call that AFib. Hyperthyroidism is known to put people into AFib.
Okay.
So yeah. With hypothyroidism, also, your system is slowing, so you can also get bradycardia. So slow heart rate. And what does that do? Hello, if your heart's not pumping fast enough, you can't get the oxygen to the brain. Yeah. So nothing's going to be getting energy anywhere. Gallstones.
There it is again.
Gallstones. That gallbladder, it like really shows up everywhere. So, and that's just because it interferes with the cholesterol. And so you can get the gallstones in your gallbladder, and you can get gallstones, and that can happen either way. Constipation. All right. So we can get constipation or diarrhea. Constipation, because when you're hypo, it actually, just like it slows the nerve conduction, it slows the motility in the gut. Mm-hmm. And so whenever you slow the motility in the gut, obviously you're going to get some constipation. But also, as a result of that, the stool stays in certain areas longer. And so you can get more water reabsorption as well. And so that just adds to it. Yeah. So, and then with hyperthyroidism, obviously it's the opposite. You're going to get diarrhea, and you can get lots of stooling. Menstrual changes. So so when you're hypo, oftentimes your period will get heavier and it can get longer. And so it seems like it's coming more frequently, but it's more because of the length of time. Mm-hmm. But it can come more frequently. And then there's a lot of stuff going on today. And then with hyperthyroidism, your period will get lighter and further apart, but more because it gets shorter. So it seems like it's further apart. But it can also space too. It can also interfere with fertility. And that's actually both ways.
Right, makes sense.
Mental health. Yeah. So hypothyroidism can make you give you a depressed mood, make you a little bit depressed and down, fatigued. And hyperthyroid can give you anxiety and agitation and nervousness. So it kind of goes along with that tremor too, that makes you kind of feel anxious too.
Yeah.
Metabolic changes, just your metabolism. So, our gut slows, so does our metabolism. It slows. So that leads to some weight gain, and that will happen with hypothyroidism. With hyperthyroidism, it will it actually speeds your metabolism, so you lose weight and you start to sweat. Bloating and heartburn. I mean, this is like
all the things.
I know. So bloating and heartburn, and that goes back to the slowed motility. With the slowed motility, then your things hang around longer. You get some bloating.
Right.
It relaxes the sphincter, so you can get your upper esophageal, it's your lower esophageal sphincter that goes right at your stomach, the entrance to your stomach. That one can get weakened, and so you can get reflux up through the esophagus. Increased appetite, that happens with hyperthyroidism, and then you're like always eating all the time.
Yeah.
Skin changes, so hypothyroidism will give you dried skin, and then hyperthyroidism gives you the like thinning of your skin. Yeah, so if you're hyper, you'll get thin skin. You could see all your blood vessels, that tears easier, things like that.
Wow.
Yeah. Hypothyroidism, not only does it do dry skin, but it also does thickening and scaling of the skin. So yeah, this is crazy, right?
Yeah.
Just a few more. Temperature and sensitivity. So you can get some cold intolerance with hypo. Yes. You always feel cold, regardless of what the temperature is. And with hyperthyroidism, you can get heat intolerance. So you're always feeling hot. You're always sweaty. It's not fun. Muscle weakness and fatigue, that's with both. And then sleep. So with hyperthyroidism, you will get less sleep. You kind of think your system is on hyperdrive. So you're not sleeping well, you're kind of agitated and anxious, everything like that. With hypothyroidism, you tend to sleep more. So these are all the things that can happen. There's lots of reasons. So hypothyroidism can be just, you could have it genetic. It can be Hashimoto's, which is autoimmune. You can have a nodule that has just started to that has like grown and just taken up space, and the thyroid isn't functioning as well. You can have nodules that make it hyperfunction. You can have Graves' disease. That's for hyperthyroidism. You can have cancer for either. You can have a goiter, which is sometimes that can be Hashimoto's, but sometimes that's iodine deficiency. So you can get that from iodine deficiency, which we're the goiter belt people in here in the Midwest. We're the goiter belt.
Is that right?
Yeah.
Why is that?
Because we have no iodine in our food other than salt, and nobody wants to salt their food anymore.
Right.
And so
because we don't eat fish.
We don't. We're landlocked, and so we don't have. And a lot of people. I mean, there are some people out there that eat sushi, but just not a big population that eats sushi. So you're not getting it from the kelp. You're not getting it from the seafood. Lots of people don't eat seafood. Right. So. Yeah, so we are the goiter belt. Yeah. So
and then when people use like Mayan salt or
the Himalayan salt or whatever,
like it's even sea salt. Like
it
there's
doesn't have iodine.
No iodine in there. So the container with the little girl and the umbrella.
Yeah,
that's what you need.
Salt. Yeah, and actually your salt will say that it's iodinized salt. And the reason that actually came about was because of all the goiters. They were like, how can we get a lot of people treated all at once? And so they thought about the salt because of food preservation and everything. And so they started putting iodine in the salt, and immediately they started seeing the shrinkage of goiters in the Midwest. So that's how your salt got iodinized. It was to treat this very reason, the goiters. So salting your food, if you have high blood pressure, it's not the best idea, but if you don't, salt that food, baby.
Yeah. I mean, I don't think it takes very much.
It doesn't.
And if you put the salt, like, don't cook with it necessarily. I mean, that would help.
You can put it on after.
But just put it right on after, and you can control like how much you're putting on. Yeah. And you get that salty taste, and
you get your iodine. Yeah. But you have to use the iodinized salt.
Yeah.
Because the, twisty Himalayan salt, it doesn't. It's pretty to look at. But
right.
It doesn't give you iodine.
Right. Where did we come up with these things?
I don't know.
Just shooting ourselves in the foot here.
I know. You know, they used to put iodine in flour.
Oh.
Yeah. So after they had this iodine in the salt deal, they were like, well, how can we get it more to people? And so they started putting in the flour for bread and everything. But then they were like, people eat a lot of bread and we don't know how much iodine they're getting. And so they actually took the iodine out and put bromine in there. And bromine is a carcinogen.
Yeah.
Right? And so bromine actually can bind to the same receptors as iodine, and because it's only one negative charge, just like iodine is. And so it will actually bind and kick out the iodine.
Why did they do that?
I don't know, what were they thinking? So then they take the bromine out. So if you look on your flour now, it says unbrominated flour, and that's why.
Yeah.
They didn't want you to have cancer. They should have put the iodine back in though, because really you actually pee out pretty much whatever's left that you don't use. You tend to pee out. So
you can't like overdo it too much.
No, not really. I mean, you could there's probably some rare condition that you can become iodine toxic, but for the most part, mostly everyone pees it out.
Okay.
So there you go.
Well, cool.
Yeah.
Well, given how much the thyroid like impacts like every system. I think it's important to note that you need to get tested if you're suspecting thyroid, because it could be a million other things.
Oh my gosh, the thyroid's blamed for everything. But my experience has been that half of the time it's the thyroid. Well, probably not even half, maybe a fourth of the time.
Yeah.
And then another fourth of the time it's a different vitamin deficiency. And then the other half of the time, it's stress. Stress does the same thing to you people.
Yeah.
It's exactly the same symptoms.
Right. But depression too could do it. Like,
yes.
So hypothyroid can cause the depressive symptoms, but depression causes the same symptoms too. So like, you could have the depression without the thyroid problem.
You can. Yeah. And they similar symptoms, you know, because your system is run down and you don't want to do anything. And so it's a struggle.
Yeah.
How do you weed it out? So testing is how we weed it out.
Right.
I usually, so TSHs, there's actually a range, and it's like 0.2, most labs it's somewhere like 0.2 to 4.59, I think is pretty much the range. So you can be hypothyroid actually with a normal TSH, because the range is actually it's an average. And what they did was they tested all these people that they were not diagnosed with hypothyroidism, and then they were like, well, this is the range, right? But some of those were probably hypothyroidism.
Great.
Yeah. So when any of my patients are above 2, I actually start testing them like every 6 months to a year, just to make sure that they're not continuing to climb.
Okay.
And then I also tell them, you know, it might be a benefit for you to do some iodine, like a multivitamin with some iodine or extra salt or whatever. You can get iodine over the counter as kelp. It's in the form of kelp.
Yes. Okay.
I have not seen it as potassium iodide. That's what's usually in multivitamins. Potassium iodide actually binds to the thyroid stronger than kelp iodine does.
Oh.
Yeah, so it's actually the better form. But however you can get it.
It's not great if you can't find it.
Right. So if you can get it in kelp, that's fine. If it's in your multivitamin, that's great too. But that's what I tend to do with people that are like 2, actually no, I don't at 2, but like 4 and up to 10, because that range is what we call it's subclinical hypothyroidism. It means that it's kind of like pre-diabetes, you know, like when you have pre-diabetes, you're going to have diabetes in 10 years. It's the same thing. When you have subclinical hypothyroidism, you don't necessarily need to be treated, but you need some kind of intervention because your thyroid's going to die in the next 10 years. I find that very interesting because sometimes that climb is so gradual. People don't, it's kind of like when you lose blood in your gut, when you have a slow, very, very slow GI bleed or some kind of iron deficiency anemia or something, your mind, it's like so slow that your body acclimates each time. So you don't really know how crappy you feel until you feel better.
Yes.
You know what I mean? And it's the same with hypothyroidism. I don't know how people really actually function between like 4 and 10.
Really?
I feel so bad for them that I treat them. And the reason is that I have hypothyroidism. Everyone can know. This is my baby is thyroid because I have it. And I had Hashimoto's, actually. I had a double whammy. I had Hashimoto's and I also was nursing at the time. And so you can get actually a postpartum hypothyroidism due to the nursing because you're like dumping a ton of your own iodine and everything. So you're just like getting rid of it. And so, and that happens in the first year when you nurse. And so I had at the same time Hashimoto's, and my TSH was only 4, and I couldn't remember my own name half the time. It was terrible. So I don't know how people are at 10. So I'm like, dude, we're treating you.
Yeah.
Because you might get lost in this world.
Scary.
Yeah. So anyways, and Hashimoto's is autoimmune. Usually what happens is you'll get a virus and your body will go in and fight the virus. And then it presents antigen to your antibodies. And antigens are proteins from the virus, right? And so your antibodies go and look for these proteins. And what can happen is those proteins can look like some organ in your system. So with Hashimoto's, it's your thyroid. And then the antibodies actually start fighting it and they attack your thyroid. Oh man, talk about a goiter. I wish I had pictures of myself then. I actually had a goiter.
You did?
I did. Yeah, it was big. And just so you know, when you go on thyroid medicine, it takes a year. You have to be stable on the medicine for a year before you feel good.
That's terrible.
And when you gain weight, like I literally gained 10 pounds overnight one night, and none of my clothes fit. I had to start wearing scrubs all the time. And so a year when you start to feel good, and then it's another year before you actually will start to lose any of that weight. Wow. It's really hard. It's very hard to lose that weight, hypothyroid weight. Yeah, but it's possible. It's possible. So, yeah. So anyways.
Well,
it's like stolen the show.
No, I think that was like really important, kind of stuff. Just a little info there. So, but there are some dietary stuff, and we talked about the iodine, which is kind of huge. There's some other like selenium and what's the other one? Selenium and zinc.
Yes, and copper. Whenever you're doing zinc, you also need to do some copper because they kind of go hand in hand.
So, I mean, obviously, like a multivitamin will just kind of do the trick, but there are places to get them from food.
Yeah.
Zinc, oysters.
You're also going to get some iodine in bet, maybe.
Yeah. Poultry, red meat.
I cannot do seafood. Oysters. Oh, gosh. Have you ever?
I know.
Oh, yeah, no. There is something about the texture that I cannot do oysters.
Right. And people, would argue like, well, for vegetarians, I mean, they don't have a face of any kind. So, are you even eating an animal? But I'm good.
They look like a body part.
Okay.
So the next time that you look at your oysters, you look and you can decide what body part that looks like. And that would be a big reason why I don't eat it. Well, that and the taste and texture.
Oh, all those things. All right. Yeah, I'm good. I'm all set.
Me too.
So other places to get zinc besides that would be like beans and nuts. All right.
Like
whole grains.
I like those.
Dairy products. Okay.
Love all that.
Speaking my language there.
I know. Me too.
And then selenium. So you've got the seafood again, like shrimp and sardines, halibut, tuna.
Sardines. Have you ever opened a can of sardines?
Yes. Well,
Oh
I've been in the room.
Oh, right. That is what I was going to say. The room smells terrible.
Yeah.
The whole room.
My grandmother, that was her favorite thing, was like spaghetti with sardines.
Oh.
They're good for you. They are good for you. I will say that.
Have you looked at them in the can?
No, I mean, not closely. Because
you shouldn't.
I don't want to. No.
They're like, you should not open a can of sardines around a pregnant woman either. The sardines will not last. They will be vomited on.
So, Brazil
Sorry
nuts.
for all you sardine lovers.
Yeah, right. We're not saying yuck to anyone else's food. It's perfectly fine.
You eat it all you want.
So selenium is also in Brazil nuts, and I think I like that because, you know, like almonds get all the press,
right?
Right?
They're like the special nut.
Yeah.
No.
And then, like, you know, walnuts have they have omega-3s.
Omega-3s.
And then like peanuts are like the bottom of the barrel type of thing.
Yeah.
But the thing is that each nut has its own nutrient profile. And so
really we should be just doing mixed nuts.
A variety. It's just one and yet another reason to eat a variety of foods. Okay. And then
we keep saying that.
We do. I really I'm big on it.
This theme.
Yeah. So soy and
here we are
greens,
back to soy.
Right.
Soy and leafy greens.
It's a little bit bad news for soy and leafy greens because they inhibit the thyroid hormone synthesis.
Yes.
Right. So it doesn't mean that you should avoid them.
You just don't want that to be like the mainstay of your diet.
Right. It could mean that if you're on thyroid hormone medicine, you might need more.
Yeah, if you're eating that a lot. But if
you're
you
eating
eat it every so often, it's fine.
Right. So the thing that's important about that, like, I mean, not that many people are like overdoing soy, so I'm not that worried about it. But leafy greens, guess where people overdo their leafy greens? Their green smoothies. Yes.
Yeah, but is that in spinach?
Yes, but not as much as like kale.
Oh, okay.
Yeah.
I don't. That's like kind of bitter. I do a lot of spinach. Occasionally, I'll do leaf lettuce.
Mm-hmm.
Is it in leaf lettuce?
No.
Okay, good. Because I always thought that was just crunchy water. So
yeah, have at it. But that's the thing is like people think, okay, if a little bit is good, then more must be great. And so let me go nuts with these smoothies and eat like these, you know, huge doses of vegetables. And once again, the message is variety. Right? If you mix it up, you
put spinach in there.
Try some spinach.
Do you know, I actually did that with my daughter. One day we were at the juice stop and she was like, "Oh, Mom, you can add spinach now." And I was like, "Oh, I'm so adding spinach." And she's like, "That is so nasty." And I was like, "Whatever, we're going to add it." So she said, she was like, "Okay, well, whatever." So I'll have her try it. And it was actually pretty good. Yeah. Anyways.
So you need some variety in your green smoothie. Or like don't have a green smoothie every day. Like just eat some food.
Yeah, there you go.
I mean, it's just an idea.
Yeah.
Okay, so the big thing, then hold on. We talked about bromide, fluoride, and mercury. Also
bind to the thyroid.
Yes.
They do. They actually bind stronger than iodine. They kick it out.
Yeah. So you know, you gotta
I always have this discussion with my dentist. And my dentist is like, "You're one of those."
I mean, like you need some fluoride, right? Your fluoride protects teeth, no doubt.
You just brush with the fluoride toothpaste and the mouthwash.
Okay, versus drinking with fluoridated water.
Versus doing fluoridated water is fine, but you don't need to do the fluoride varnish on your teeth unless you are drinking water that's not fluorinated.
Okay, well,
then you're fine. You know.
Yeah.
If you don't have fluoride in your water, then you need it for your teeth. So you know, risks and benefits.
Right.
Yeah.
So, but because some, you know, like if you have like a reverse osmosis filter on your water, then you're not going to get fluoride. So then, then you might need fluoride treatment. Okay, that's a little sidebar. Coffee, another thing that could cause you to need a higher dose of your levothyroxine. If it's not working for you, you might need to like stop drinking coffee.
So here's another thing. Levothyroxine sucks.
All right.
There's like only a few medicine types that I really push brand name on. And then the rest of them, I'm like, whatever you want to do, generic or brand name.
Okay.
Levothyroxine does not keep good blood levels. You chase them all your life. Thyroid, which is brand name, keeps good blood levels. There's no studies out there. I can't give you any study. I can't prove it to the insurance either to make them pay. But what I can tell you is from experience, looking at a lot of patients' blood levels on levothyroxine versus Thyroid, I very rarely make changes after I get somebody leveled off with Thyroid, but I am constantly chasing that levothyroxine.
Isn't that interesting?
I personally never take levothyroxine, only brand name Thyroid. And there's ways to get it cheaper.
Yeah.
Yeah. So.
All right. So now we have to talk about gluten.
Yay. That leads into our next topic.
It does. Yeah. It does very well.
Gluten.
So celiac disease
is pretty common.
It's common.
Well, it's common. It's not rare. Let's say it that way.
It is, yes, there we go. Yeah. It is not rare, but it is a common sort of underlying cause of Hashimoto's. And they're both autoimmune.
Yes.
So that makes sense.
Yes. Same virus.
It's sometimes undiagnosed.
Yeah.
And
I never have problems with gluten, to be honest with you.
Right. And there you go. Like this whole thing, like gluten can be sort of the
devil. But it's not always.
It's not always. Like some people have trouble, with tolerating gluten. Like whether they have celiac, obviously then they need to avoid it altogether, or they just have some kind of intolerance to it, and it causes, issues in the gut that can impact your thyroid, because the gut is the center of the immune system, and then when the when it's off, then it affects all these other places. Yeah. But it's just like lactose intolerance. Like, doesn't mean that you need to avoid it altogether, and it doesn't mean that everyone needs to avoid it, because some people don't have that.
Yeah, everyone's different.
I am not lactose intolerant.
Yeah.
So don't just say, "Oh, I have thyroid. I need to get rid of these. I need to cut these things out of my diet."
Yeah. No. Okay. You have to figure out what you need to cut out.
Yes.
Yes.
So the thing about gluten, and I will be entirely honest, this is not my area of expertise. Like not like gluten and gluten sensitivity and leaky gut, which is something we're going to talk about. This is not not my area of expertise. So I'm just scratching the surface. I'm just sharing what I know, which isn't a ton, but I think it's enough to give you some information about it.
Yeah.
So I just want to qualify my information that there are dietitians whose expertise is right here. Like this is what they do. They help people with leaky gut, with food intolerances, sensitivities. They do testing. They do all this stuff, elimination diets, the whole nine. I don't do that.
Okay.
But I know a thing or two, at least, that can help if you don't want to go that route of sign me up for the whole shebang. I want to get all these things tested. I want to cut out all this stuff out of my diet. There's some basics, and that's a whole other, maybe next time. We could talk about.
We should talk about gluten.
Yeah. What are the things about gluten that we need to worry about?
Yeah, because, we should. That's what we'll do next week.
Yeah.
Did we have anything else on this topic? We kind of banged it around.
We did.
A lot.
But I think,
it's a big topic, though. I could talk about thyroid all day.
I bet you could.
Yeah.
Yes. So, we do have leaky gut on there, but we also have gluten. So
let's do gluten.
Gluten, and probably leaky gut's going to come up. You can't.
It'll lead into the next week.
Yeah.
All right. So, gluten sensitivity, intolerance, celiac. That's next week.
Yes.
Hopefully we will do it some justice, like we always do. And then we'll go eat candy because it'll be Halloween.
That's right.
Maybe we should dress up. That'd be fun. Yes. She's like,
I love dressing up.
Love you so much. Yay. Okay, well, who knows? You'll have to tune in to see if we dress up or not.
Yes.
So we do hope that you have a good rest of your week, and we will see you next week, and we will be talking about gluten. If you have any questions or anything, or if you have a topic that you want us to talk about, please let us know. You can put it in the comments. We always read them. And then we will see you later. So have a good rest of your day, guys. Thanks. Bye.